Madriao Davao. We are honored to have here with us this morning our partners in health and from the Department of Health, the United States Embassy, Agency for International Development, the United States Department of Defense, and the City Government of Davao. I'm Melissa May Roselio, and I will serve as the Master of Ceremonies this morning. So today, we will be witnessing another impactful development of the partnership between the Davao City Government and the U.S. Embassy through USAID. And as we continue to overcome the challenges brought about by the COVID-19 pandemic, the COVID-19 response and vaccination rollout in the city have been successful through the collective efforts of the City Government of Davao, the Department of Health, and the USAID. Reaching new heights of this health alliance, the Government of Davao City and the USAID will launch the COVID-19 clusters today. COVID-19 cluster clinics today. So to officially open this event, we have with us Dr. Ashley G. Lopez, the City Health Officer of Davao City. He and his team have been at the front line during the pandemic and continuously providing quality healthcare services for Davaoenos. May we please welcome Dr. Ashley G. Lopez.
To our guest, Peter Variaba, Chargé d'Affaires of the U.S. Embassy in the Philippines, Michelle Langali, Director of the USAID Office of Health, Dr. Yolanda Oliveros, Deputy Director of USAID Office of Health, Ms. Consuelo Anuevo, Project Development Specialist, USAID Philippines, Major Scott Hollow, Commander of the Special Operations Task Force 511.2, First Sergeant Rigoberto Melendez, Special Operations Task Force 511.2, Captain Spencer Schaefer, Civil Affairs Officer of the Special Operations Task Force 511.2, Dr. Lorenzo Stan, Chief of Party of the USAID Bridge Health, ASEC Roy Ferrer, Assistant Secretary of the Department of Health, to all our the core team as well of the City Health Office and the COVID-19 operations, and to our special guests. Madriao Davao, welcome to Davao City. To our city officials led by our Mayor, Honorable Sara Duterte. Morning, ma'am. Mayong buntag, a pleasant morning to all of you. And I would like also to add up acknowledgement to Sian Calyahan, Mission Director of the USAID. Welcome. Mayong buntag, a pleasant morning to all of you. I am honored to be able to welcome all of you this day as we launch and officially open the very first COVID-19 cluster clinic in the country. This day is momentous for at least 3 reasons. First, the CCC is a manifestation of all the efforts in Davao City since the start of this global pandemic. The last year and a half surely has been a long journey of learning, unlearning, and even relearning. The CCC shows how we stood strong and stayed resilient in our battle. Second, today we are all gathered in a shared space to honor each and everyone who have played a strong role in our COVID-19 response and management. From our people who have worked day and night and continue to be in the front lines to serve our people. And this wouldn't have been possible without the leadership of our Honorable Mayor and the support of the Department of Health, as well as partners in USAID's Rich Health. Third, today also reminds us that COVID-19 is still very present and palpable in our day-to-day lives. Given the uncertainties of when this pandemic would end, today, however, signifies how Davaoenos will remain steadfast in all our efforts. Once again, thank you for sharing this day with us and welcome.
Thank you so much, Dr. Ashley Lopez, for the warm welcome to everyone. And thank you also for walking us through the CCC and the assistance on the COVID-19 response provided by the U.S. government to the government of Davao City. May we now hear from our partner to introduce to us the United States Acting Ambassador to the Philippines. We have with us Mr. Sean E. Callahan. Mr. Sean E. Callahan is the acting USAID Mission Director for the Philippines, Pacific Islands, and Mongolia. Mr. Callahan previously served as the Deputy Assistant Administrator for Program Operations in USAID's Bureau for Legislative and Public Affairs, or LPA, which includes the Office of Website Management, the Office of Internal Communications, and the Office of Program and Management Operations. Let us all give Sean Callahan a warm round of applause.
Good morning. My name is Sean Callahan. I am the USAID Acting Mission Director for the Philippines, Pacific Islands, and Mongolia. USAID, if you're not familiar, is the premier U.S. government agency for development assistance and humanitarian assistance as well. And we have been here in the Philippines since 1961, the same year that USAID was founded by President John F. Kennedy, partnering with the Philippine government and the Philippine people. But it's not me to talk about USAID right now, but my honor to introduce our Charge d'Affaires at interim, Heather Variaba. Ms. Variaba is a member of the Senior Foreign Service who is at the rank of Minister Counselor. She has just recently arrived in the Philippines only a few months ago, and this is her first trip outside of Manila. So it's very special that her first trip is very significant that she came here to Davao. And I want to welcome her. She is she's not new to the Southeast Asia with service across Southeast Asia, most recently in Jakarta, Indonesia, where she served for many years as our Deputy Chief of Mission for the U.S. Embassy to Indonesia. But without further ado, I'd like to welcome our Charge d'Affaires editor from Heather Variaba.
Sara Duterte, Department of Health Undersecretary, our Davao City Health Director, partners from the national and local governments, and my colleagues from USAID, Department of Defense. Good morning. Maria Davao. I'm pleased to join you here in Davao City to hand over COVID-19 supplies provided by the U.S. government. The United States is committed to supporting COVID-19 response efforts across the Philippines. We are confident that the vaccine refrigerators and ICU beds donated by the U.S. Department of Defense, as well as the vaccine teams, equipment, and other technical assistance provided by the United States Agency for International Development, or USAID, will help you in your continuing fight against the pandemic. Through COVAX, the United States has facilitated the delivery of more than 29 million vaccines to the Philippines thus far, including almost 19 million made available by the American people to the Philippines, of which almost a million delivered directly to Davao. Recently, the United States also donated COVID-19 supplies to Cagayan, Iligan, and Cotabato, so that healthcare workers across the southern Philippines can reach more geographically isolated areas. Our partnership to combat COVID-19 in the Philippines is the latest example of the long history of cooperation and partnership between our two nations. This year, the United States and the Philippines celebrate 75 years of diplomatic relations. And every day, we continue to expand and deepen our cooperation with the Philippines in many areas, not only in the health sector, but also in security, trade, education, and more. This month marks another special U.S.-Philippines milestone. As Sean mentioned, we celebrate the 60th anniversary of the USAID partnership with the Philippines. Since 1961, USAID has invested nearly 250 billion pesos to achieve shared development goals in partnership with the Philippine government, the Philippine local organizations, and the people of the Philippines. When it comes to leading in the fight against COVID-19, the U.S. government is building on decades of global health partnership and leadership and decades of trusted friendship. In the Philippines, we continue to work with the Department of Health and local government units to expand access to testing and treatment, to train health workers, to deliver life-saving equipment, and to expand the vaccination campaign. Here in Davao City, the United States will continue to support our hardworking partners as they implement an effective public health response to increasing testing capacity, improving disease surveillance, and strengthening the city's vaccination campaign. We will also support the establishment of an additional 8 COVID-19 cluster clinics like the one here today that we are at, 4 of which will be operational by the end of the month. These USAID-supported COVID-19 cluster clinics will offer all services for free. They are designed for effective and efficient triaging, testing, contact tracing, monitoring, and management of COVID-19. They will also assist with the referral of patients from high-risk communities to appropriate health facilities for case management. I know that Davao's whole government approach has fortified the city's pandemic response with logistical, human resource, communications, and policy development support. Combating this health crisis will take time and collective action, especially as health systems remain under stress. We also face the additional challenges of learning loss, gender-based violence, and food insecurity as a result of the COVID-19 pandemic. The United States is committed to working with you and with all of our partners in the Philippines to find adaptive solutions to COVID-19 cases, to bring them down to manageable levels, to strengthen the resilience of local communities, and move the Philippines to a better normal. In closing, let me say thank you to all of the frontliners, our healthcare workers, who continue to serve and protect us from the pandemic. I salute all the hard work and sacrifices that you are enduring to keep us safe, protected, and healthy. It is indeed a pleasure for me to be here in Davao City today. As was mentioned, my first trip outside of Manila, and I'm really delighted to see another part of the Philippines, and I'm looking forward to seeing many more parts of the Philippines and Mindanao in my coming 3-year assignment. As a friend, partner, and ally, the United States is with you in fighting COVID-19 and in facilitating long-term initiatives to ensure the health, peace, and prosperity in the southern Philippines. Mahalman salamat. Thank you very much.
Thank you so much, Mr. Shan.